The SNP has been slated over its management of the Scottish NHS during the coronavirus pandemic. It can be revealed today. A damning report by the Scottish Auditor General revealed pandemic planning failures by the SNP-led Scottish Government may have contributed to PPE shortages and stretched social care capacity that hindered Scotland's response to the COVID-19 outbreak. Scotland's initial response to COVID-19 was based on preparations for a major influenza pandemic, with 3 government training exercises carried out in the past 5 years. Specific recommendations emerged from the pandemic preparations, including securing personal protective equipment (PPE) and increasing the capacity and capability of social care to cope during an outbreak. But the new report by Auditor General Stephen Boyle concludes the Scottish Government was slow at implementing the improvements from the simulations in some of the areas that would become a significant challenge during the pandemic response. While it praises the government's fast response to the coronavirus outbreak, the report made clear the Scottish Government could have been better prepared to respond to the COVID-19 pandemic and lessons must be learned. The report added, it based its initial response on the 2011 UK influenza pandemic preparedness strategy but did not fully implement improvements identified during subsequent pandemic preparedness exercises. Failures include a lack of guidance about how Scotland's social care sector could cope with a flu pandemic, despite being identified as a priority. Although the Scottish Government consultation on some draft advice between July and September 2019, nothing was ever published. One of the simulation exercises also highlighted the need for substantive progress in the area of PPE availability and use across Scotland, with clarity about accessing a stockpile of equipment identified as another priority. Audit Scotland recommended the SNP-led government publishes national pandemic guidance for the health and social care sector as a priority, including lessons that have been learned during the COVID-19 pandemic and the previous planning exercises. The report further states that actions taken to prevent Scotland's NHS from becoming overwhelmed during the pandemic meant the health service was now facing a substantial backlog of patients. It adds, it will be hard to deal with this backlog alongside the financial and operational challenges already faced by boards. The report also referenced a Royal College of Nursing (RCN) survey from April that found 47% of nurses in high-risk areas were asked to reuse PPE, and a quarter had not had their mask fit tested. Commenting on the report, Mr. Boyle added, NHS staff have shown extraordinary commitment to treating and caring for Scotland's people during a pandemic that has highlighted the need to deal with long-standing health inequalities.